Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala Rasulillah wa ala alihi wa sahbihi wa man tabi'ahum bi ihsani ila yaumiddin. Amma ba'du. My name is Umar Abdul Aziz. My friend, do you know what is lymphoma? If you don't know, let us study together. Lymphoma is a group of blood malignancies that develop from lymphocyte. The name often refers to just cancerous version rather are such tumor. Sick and symptoms and included enlarged lymph nodes, fever, clenching, unintended weight loss, itching, and constantly feeling tired. The enlarged lymph nodes are usually painless. The sweats are most common at night. There are two main categories of lymphomas. There are the non-Hodgkin lymphoma and Hodgkin lymphoma, but many subtypes of lymphoma are known. About 90% of lymphomas are non-Hodgkin lymphomas, and about 10% are Hodgkin lymphomas. Lymphomas and leukemias are a part of broader group of tumor of the hematopoietic and lymphoid tissue. Risk factor of types of non-Hodgkin lymphoma included autoimmune disease, HIV or AIDS, infection with human T lymphotropic virus, immunosuppressant medication, and some pesticide. Risk factor for Hodgkin lymphoma included infection with Epstein-Barr virus and history of disease in family. Eating large amount of red meat and tobacco smoking may also increase the risk. So stop smoking now. How to diagnose? If enlarged lymph nodes are present, is visually by lymph node biopsies. Blood testing, urine testing, and bone marrow testing may also be useful in the diagnosis. Medical imaging may then be done to determine if and where the cancer had spread. Lymphoma most often spreads to the lung, liver, and the brain. Treatment may involve one or more of the following: chemotherapy, radiation therapy or radiotherapy, proton therapy, targeted therapy, and surgery. In some non-Hodgkin lymphoma, an increased amount of protein produced by the lymphomas caused the blood to become too thick and to spread in, so it must perform the remove of protein. Watchful waiting may be appropriate for certain types. The outcome depends on subtypes, with some being curable and treatment prolong- prolonging survival in the most. Worldwide, lymphomas develop in 566,000 people in 2012 and caused 305,000 deaths. They make up 3 to 4% of all cancers, making them as a group of 7 most common forms. In children, they are the third most common cancer. They occur more often in the developed world than the developing world. That's all about my presentation. Thank you very much for your great attention and active participation to this presentation. Akhirul kalam. Wassalamualaikum warahmatullahi